Hello, this is the recording of the participant information sheet of a study called NeuOst. This is a multimodal manual therapy based intervention for people with painful diabetic neuropathy, and we are conducting the feasibility study of a randomized controlled efficacy trial. My name is Dr. David Hohenschurz-Schmidt. I'm a senior research fellow at University College of Osteopathy and a research associate at Imperial College London. I'm leading this project and I've developed the intervention together with a group of research collaborators, clinicians and patient partners. And we would like to invite you to be part of this research study. But before you decide, we want to explain why we are doing this research and what it would mean for you to take part. You should also be taking the time to talk to others about the study. And if you want to ask us any questions, if something is not clear, then please do contact us. There are contact details on each slide, and at the end of the presentation there's a big slide with all the necessary contact information. We want you to feel comfortable and informed before you decide whether to take part or not. So please do take time to watch the following recording and then decide whether you wish to take part. Now let's start with the content of the participant information sheet. The first question is, what is the purpose of the study? And we're doing this because we want to find a better way to help people who have a health problem called painful diabetic neuropathy. As you may know, this happens when someone with diabetes has a lot of pain in their feet. Many people with diabetes suffer from this pain and it can make life difficult. And there are not many good treatments available for this pain, and some of the medicines that doctors can use have side effects. And we want to try a new treatment called NeuOst to see if it can make the situation better. NeuOst is a combination of different drug-free therapies that aim at improving well-being. This approach includes hands-on manual therapy, some exercises, and learning ways to address feelings and thoughts about living with painful neuropathy. But before we can try NeuOst with a lot of people, we need to see if it works well and if people can use it easily. So we are doing a small test study first, and this is what we're doing here. So we taught trained therapists, specifically so-called osteopaths, how to do NeuOst, and now they will treat a few people with painful diabetic neuropathy. And we will compare this new treatment to another treatment and to the usual care received by participants. The other treatment is a modified version of NeuOst, which lacks some part of the intervention that we are interested in, which allows us to compare them. We also want to see if people like NeuOst and if they find it helpful. And this information will help us to decide if we should do a bigger study with more people later on. We hope that NeuOst could become a good way to help people with this painful problem. You have been invited to be part of this study because you probably have painful diabetic neuropathy, or you have diabetes and pain in your feet. You are not the only person who's been contacted or chosen for this study. There will be about 35 other participants. You may wonder whether you have to take part. The answer is no. It is up to you to decide whether or not to take part. If you do decide to take part, you will be given this information sheet to keep, and you will be asked to sign a consent form. If you decide to take part, you are still free to stop your participation at any time and without giving a reason. A decision to stop the study or not to take part will not affect the standard of care you receive either at University College of Osteopathy or elsewhere. When and where will this study take place? If you decide to participate in this study, then you will be part of a research trial called NeuOst, as we said. And from April 24 onwards, the trial takes place at the clinic of the University College of Osteopathy, which, as you can see on this map, is located in Southwark in central London. Specifically, that's in Southwark Bridge Road, which is London SE1, a few minutes from Borough and Southwark tube stations and a longer walk from London Bridge Station. The clinic provides a comfortable and accessible environment with individual treatment rooms and wheelchair access. There are also bus stops directly at the clinic. Treatments during the trial will be delivered by fully qualified and registered osteopaths who've been specifically trained to deliver NeuOst. There are up to 5 study visits, followed by 2 phone calls, all over the course of about 16 weeks. Appointments can be scheduled flexibly from Monday to Saturday. I'll now talk you through what exactly will happen to you if you were to take part. And the study involves the following steps over the course of about 16 weeks. This figure shows you the beginning on the left-hand side, the treatments, and then follow-up assessments. Before the first day, the baseline assessment, you would have had, or maybe have already had, a phone call to determine if you qualify to participate. You will then be sent this participant information sheet or the recording that you're just watching and a consent form. You can talk to others about the study if you want, and please do ask us any question if something is not unclear. Like I said, we want you to feel comfortable and informed before you make your decision. If you decide to go ahead, you will have to sign the consent form and return it to us, either via the post or when you come in for your baseline assessment. And after this, after you've signed the consent form, the study starts for you. Now let's look at the first box here, the baseline assessment. This can be done via the phone or on a video call or in person at the clinic. For this assessment, a member of the study team will ask you various health-related questions. The questions will cover topics such as pain, diabetes, medications, physical activities, general health, mental health, sleep quality, and social functioning. This assessment should take about 1 hour. And during this clinical interview or any of your study visits, if any reasons are found that suggest you should not have been included in the study, such as safety concerns with manual therapy or exercises, you will be informed and you will not continue the study. But if you are found eligible and choose to participate, you will be randomly assigned to one of 3 groups. This is what's called randomization on the graph that you're seeing. After this random allocation, you will either receive the NeuOst intervention or a specifically designed control intervention or no further treatment as part of the study. If you are in this last group, which we call the usual care group, that's the white box on the graph, you will only continue your normal medical care. With us, you will have regular phone calls to check in on how you're doing. We call those assessments on the figure here. But you will not have treatment visits in this group. This usual care group is important so we can compare our treatments to the normal care received on the NHS. And patients assigned to the other 2 groups will receive the NeuOst treatment or a similar comparison treatment during 5 treatment visits, with more or less 1 treatment every week. What we call the control or comparison treatment, this is used because we are still in the process of testing if the new NeuOst treatment is helpful. So we do need a comparison. However, this control treatment is the same as the NeuOst intervention, apart from a few components, the effects of which we aim to study. Neither you nor the clinical staff, anyone else other than your direct treatment provider, will actually know which of the 2 interventions you receive. This approach is important so we can compare the effects of the treatments irrespective of your expectations and beliefs about them. Your first treatment visit will be one of the study osteopaths. Your first treatment visit with one of the study osteopaths will take about 90 minutes, as they will need to establish more about your health and get to know you. Ideally, this first treatment will take place only a few days after the baseline assessment, and it can be scheduled to fit your schedule. Treatments consists of hands-on manual therapy, talking about your experiences, learning important things about diabetes and its complications, and you may also be given exercises to do at home. After this first treatment, up to 4 more treatment visits will be scheduled, ideally 1 week apart. We call those the 5 treatment visits. Each of them lasts about 1 hour. And during these visits, you will complete short weekly questionnaires about your health and daily activities, and you will receive the trial intervention based on your random assignment. Now, please note that some treatment sessions may also be audio and video recorded for quality control reasons. You may, however, opt out of such recordings. After 5 weeks, patients in all groups will be asked to complete the same questionnaires as during the baseline testing. On the graph here, this is called Assessment 1. Additionally, after 8 and after 16 weeks, a study team member will call you to go through those questionnaires again. These are Assessment 2 and 3. Attending these phone calls is crucial for the study to gather important information about how you feel regarding the study treatments. If you wish, you can also participate in an interview and provide feedback for future development of the NeuOst interventions afterwards. Throughout the study, appointment scheduling will be flexible, and the clinic's reception team will work with you to find suitable times that work for your visits. There's no minimum number of required visits, and if needed, appointments can be scheduled within a certain time frame. Ideally, however, you do attend all 5 clinical visits if you are allocated to a treatment group. It is also important to take part in the testing phone calls so that we can learn about your progress. Throughout the study, your participation in this study will help us to understand if the NeuOst intervention is feasible and if it is safe, and if it could be a promising treatment for people with painful diabetic neuropathy. Your well-being and comfort are essential to us throughout the study, and we will make every effort to accommodate your needs during this research. At the end of the study, you will be informed of the findings, which treatment you received, and you can ask us any questions you may have. If you would like to be part of this study or would like further information, please contact the principal researcher, which is myself, by phone either on 07523 629 286 or email me on david.schmidt@uco.ac.uk. If you happen to come by the clinic, you can ask a member of the study team or the clinical team for the consent form and sign it to enter the study. You will then be expected to complete the steps that we just presented, although, as I said, you can leave the study at any point and without giving reasons. To really make an informed decision, I'd like to present to you or talk to you a little bit more about potential disadvantages and benefits of taking part. This is important to make an informed decision about taking part. So please listen carefully to the section and do ask any questions if you would like further information or have any concerns. Overall, we do not expect any major risks to you personally from this study. One disadvantage is the time required for you to attend study testing sessions and treatments of which we don't yet know if they work. As described later on, this is often the case in research studies. Further, you might also share personal or sensitive information with the study staff or with your treating osteopath, but they will handle it confidentially. Your information and clinical notes will be protected according to the regulatory requirements of the osteopathic profession and UK scientific standards. You may also be asked to partially undress for the treatment. Where desired, privacy gowns can be provided, and you can ask for a therapist of the same gender. Please let the clinic staff know if you prefer that. Generally, bringing loose-fitting clothing, such as trousers that can be rolled up above your knees, is advisable. Some people can also experience soreness after osteopathic treatments, but this is usually short-term and self-limiting. You may also be asked to perform exercises in the clinic or at home. These exercises may cause some muscle soreness and slightly increase your risk of falling. However, your osteopaths would practice these exercises with you. To make them safe, all exercises can be adapted to your needs and abilities. As you are aware, people with diabetes may have low sugar episodes, so-called hypoglycemic episodes, that can pose a health risk. We don't expect this study to increase the risk for these episodes, and all study clinicians are trained to recognize and manage those hypoglycemic episodes. Importantly, this study does not affect the care you receive otherwise from your doctors, or it doesn't change the medication that you take. We only ask you to not see other osteopaths, chiropractors, massage therapists, or physiotherapists during the study period. This is necessary for us to be able to tell that any changes you may experience are due to our treatment, not somebody else's. You will also wonder what the possible benefits are from taking part. And we want to be upfront with you and let you know that participating in this study might not directly benefit you personally. The treatments we are testing may or may not bring immediate benefits to you, and there is a 33% chance that you may not receive any treatment at all as part of this study. We are conducting this study precisely because we don't yet have enough information if the treatment will be helpful or not. However, by joining the study, you'll play a role in advancing scientific knowledge. And while there is a possibility that the research could lead to new and effective treatment for people with painful diabetic neuropathy, we can't guarantee that this outcome will come about at this stage. However, by participating, you will contribute to a broader understanding of this condition and potentially pave the way for better treatments in the future. And we really truly appreciate your willingness to be part of this research study, should you decide to take part. You may have some expenses as part of taking part, and it is important for you to know that you will be reimbursed for your travel expenses to each in-person clinical visit. So if you're assigned to one of the treatment groups and have to come into the clinic, the travel reimbursement of up to £11.40 will be reimbursed. This is the maximum pay-as-you-go travel cost within TfL zones 1 to 4. Additionally, you'll be compensated for your time with payments of £15 per testing session, per assessment. So these are the calls where you'll be answering questions about your health. And together you can receive a maximum of 4 of these payments for testing, or £60, regardless of how long each appointment takes. These payments are there to support you to take part in the study, but should not be seen as the only reason to participate. If needed, you may receive the payments after each testing appointment, or they can be given together at the end of the study. What happens if there is a problem? If you wish to stop participating and withdraw from the study, you are free to do so at any time and without giving a reason. Leaving the study will have no negative effects on your legal rights and your medical care from your GP or your specialist providers or from us. Study-related treatments and assessments, however, would stop after withdrawing. If you have any concerns about the nature or conduct of this research study, or when you're on the trial about the treatment providers, please contact me, the principal researcher, David Hohenschurz-Schmidt, or any other member of the research team. If you feel that I can't successfully or adequately assist you, you can contact Stephen Vogel, who is the representative of the study's host institution. His email address is s.vogel@uco.ac.uk, or you can contact Dr. David Evans, who is the chair of the Independent Oversight Committee looking after and monitoring this trial. You may also wonder whether your participation in the study will remain confidential. The answer is yes. All data collected during the study will be treated as strictly confidential. Apart from your clinical notes, any information gathered for research purposes will be anonymized to protect your identity. Only the research team will have access to the data, including myself, the principal researcher, and staff involved in the analysis of the data. The study has received approval from the UCO Research Ethics Committee, which ensured that UK ethical and data protection standards are followed. Your personally identifiable information will be securely stored on password-protected servers at the UCO. At the study's conclusion, these data will be securely stored at the UCO and later destroyed in accordance with research guidelines. Some non-identifiable data, so data which can't be traced back to you, will be shared publicly online for other researchers to use freely. For example, to check our own results or to conduct similar research in the future. The final study results will be shared with the funders of the project and be disseminated to the public as part of academic conferences and research articles. There may also be magazine articles, blog and social media posts, videos or podcasts about what we have found in the study, but your identity and personal information will always be protected. The results will also be used to plan further steps for the NeuOst project. Depending on the results, next steps may include conducting a larger clinical trial, modifying the project, or even abandoning it. We will also share any unidentifiable data publicly to facilitate further research, like I just said. You and other participating patients will receive a summary of the study results. That is, if you tick the corresponding box on the consent form, so you can decide whether or not you want to receive such a summary. Participating osteopaths and research team members will also receive a summary of the full study results. Like I said, it's not just myself leading this project. Although I'm coordinating this, my name is David Hohenschurz-Schmidt at UCO, the University College of Osteopathy and Imperial College London. The host institution is represented by Stephen Vogel, who is also the Deputy Vice Chancellor at UCO. Other researchers in this team include Sasha Smith from Imperial College London, Professor Anina Schmidt from Oxford University, Dr. Esther Williamson, also from Oxford, Dr. Whitney Scott from King's College London, Dr. Jan Follett from University of Exeter, Professor Esther Pogatsky-Zahn from Münster University Hospital in Germany, and my professor at Imperial College London, Andrew Rice. There is also an independent trial steering committee. They are monitoring the quality and the ethical conduct of the study as it goes on. The chair of this committee is Dr. David Evans from the University of Birmingham, and the patient representative is Elizabeth Piggott, a person also living with painful diabetic neuropathy. Importantly, we also involved other people with painful diabetic neuropathy in the development of this project. So trial procedures, information materials, and the NeuOst treatment and the control intervention were developed and pilot tested with our patient partners. These are lay people living with painful diabetic neuropathy. Like I just said, one of our patient partners is also part of the trial monitoring committee. Now finally, I'd like to thank you for taking the time to read this information sheet. On this slide you can see the contact details should you have any questions or want further information. To obtain a consent form if you don't have it already, or to arrange how to sign it, please contact myself as the principal researcher. My email address is on this slide. It's david.schmidt@uco.ac.uk, or you can call me on 075 23 629 286. Thank you very much for